Good afternoon, and welcome to Green Chat. My name is Christy Medeiros, and I am the area manager for Massachusetts, Connecticut, and Rhode Island at Canacare Docs. We are one of the largest cannabis certifying companies in the United States. We have clinics in Colorado, Delaware, Maine, Maryland, New Jersey, New York, Pennsylvania, and now in Virginia. So if you're watching from one of those states and you're wondering how you can certify with your state's program, just give us a call at 866-846-2420, and we'll give you the information that you need to certify in those states. I have been here a few times, and again, like I said, I am Massachusetts, Rhode Island, and Connecticut. But I want to give a shout out to the area managers in those other states that I just mentioned. Maggie and Erica, thank you so much for all you do. Not only do I have the pleasure of working with these wonderful ladies, but you as a patient will be assisted by them, their team of providers and education specialists throughout your entire cannabis journey. So if there's ever a point that you need to speak to us, we are all here to help you throughout. So today is Tuesday, it's October 20th. I tend to look every day at the national holidays, and just for fun, today is International Sloth Day. Everybody loves sloths. Today is also National Pharmacy Technician Day. So I just want to give a shout out and a thank you to all those pharmacists out there that are keeping us informed on the medications that get prescribed to us daily. And it also is World Osteoporosis Day. Osteoporosis is a disorder defined by reduced bone density, which decreases bone strength and results in fragile bones. With this disease comes pain, inflammation, trouble sleeping, depression, and anxiety. These are all conditions that can be very therapeutic and beneficial when using cannabis plant. So last time I was here, I was discussing the importance of having your card. A lot of questions came my way, and the biggest question was, how does this plant work for me? What's in this plant? So I decided to come back on and just let everybody know, just a couple of things about the medication that we are using and what's in your medication, what's in this plant. So this week, we're going to discuss the benefits itself and what it contains and the difference of cannabinoids and terpenes. So when I started my journey here with Canacare Docs, I was introduced to a whole new world of information pertaining to cannabis. I knew how to consume it, but I didn't know exactly what type I was consuming or what kind of effect it would have on me. Sometimes it would lift me up and make me feel good. Other times I'd want to lay down and take a nap. Then there's times that I'd want to eat a whole bag of cookies. So 3 different effects from a plant that I thought was all the same. But as you know now, there are many different strains of the plant with all different types of medicinal benefits. Past couple of Tuesdays on Canacare Docs, the website, we actually highlight a terpene. We call it Terpene Tuesday. So if many of you have not been on our Facebook page, go on and check it out. But we do put on some terpenes each Tuesday and just describe the benefits, the medical benefits that you'll get from these terpenes. And most people don't even know what a terpene is. So what is a terpene? A terpene is a compound found in a variety of plants, including cannabis. They're responsible for the aromas and the flavors in the plant. Terpenes have medical benefits such as anxiety relief, pain relief, helps with insomnia, and so on. So some of the more common types of terpenes that we have, pinene. Pinene is beneficial with promoting alertness, and it is actually an insect repellent. Humulene is an appetite reducer, an antibacterial. Humulene can also be found in hops, sage, basil. Myrcene is a sedative, antispasmodic. It can also be found in thyme, mangoes, and parsley. And the list of terpenes goes on. Those are the most common. There's lots of other different common terpenes that can be found in your cannabis plant. And like I said, they're also found in other plants and that we use daily. Hops is made with beer. So again, terpenes are in mostly everything that you consume. So in addition to having these terpenes, we also have hundreds of cannabinoids in these plants. And these cannabinoids interact with our body's receptors. They provide medicinal benefits such as anti-inflammatory, anti-anxiety, anti-seizure, helps induce sleep. There are many cannabinoids in the cannabis plant, and the most common being THC and CBD, which most people know about. THC is what gives you the quote unquote high feeling. CBD gives you the pain relief. It's the non-psychoactive cannabinoid in the cannabis plant. There is also CBN and CBG. In addition to all those other cannabinoids, they help with pain relief, inflammation, ailments that we suffer from, cancer or osteoporosis, scoliosis, rheumatoid arthritis, chronic back pain. You've been in a car accident and none of your other medications are working. So, switching over to using this plant could be a therapeutic benefit for you. So now when these terpenes are combined with cannabinoids, they produce a more desirable effect. This is what's called the entourage effect. And this effect actually, if you want to think of it as having a bowl of ice cream and then having a hot fudge sundae. Obviously, the desired effect is going to increase with your bowl of ice cream with your sundae as opposed to your bowl of ice cream. So this is the way you can kind of look at your plant and see what's going on inside. So most people have never tried this form of medication. A lot of questions come my way from the older population just asking, I don't want to get quote unquote high. I don't want to feel dizzy. I don't want to feel sleepy. So there are many ways to use this form of medication. Medical cannabis is trial and error for everyone. Just like with your traditional pharmaceuticals, just because a medication works for your brother, it doesn't necessarily mean it's going to work for you. So everyone's chemical makeup is different. So you kind of have to learn what's going to work best for you. You definitely should keep a journal of all the products that you're using and consuming and you're buying. In your journal, you should note your strain name as well as how you're consuming the product, what kind of dosage you have, the percentage of THC and CBD, and then describe the effect it has on you. We all go to the doctors and we all try medication, and a couple of months down the road, we're trying this medication, it's not working. We go back to the doctor and the doctor says, try this or add this or try this with this. So the same thing with your cannabis medication. The first medication or the first product that you use might not be something that is going to get you the relief that you need. So don't stop, don't discontinue, trying to use it, try something else. We are here at Canacare Docs to answer any questions. So if you have questions about forms of medication or consuming medication, or you consumed medication that you don't like, give us a call. We'll let you know what you should or shouldn't try with or without, your pharmaceuticals. Again, this is all trial and error. It doesn't necessarily mean it's going to work on the first shot. So we always tell our patients, please make sure you keep a journal and keep a list of all the products that you are consuming. So when you put your journal together, the products you consume, you kind of want to ask yourself, did it relax me? Did it make me happy? Did it make me feel good? Did it make me sleepy? Did it make me hungry? Did it take my pain away? There's so many effects that the cannabinoids and terpenes will have together. So once you get your journal and after, say, a month of journaling, you want to go down the list and see, okay, well, this was a good day. I liked that. This was a good day. I liked that. And then continue to use those products and try other products that you think might also help you. Again, it is all trial and error. So you definitely want to, try something, doesn't work, try it again. Try something else, doesn't work. Again, with different percentages and different levels of THC, that could be a reason why you're not getting your desired effect. So you might want to go up in percentage of your THC. So again, just like in your pharmaceuticals, you're taking a 10 milligram pill, it's the same thing with your cannabis. You definitely want to be on a good milligram. And if it's not working for you, up it a little bit until you get that desired effect. So with that being said, I just want to consume, I'd like to quickly discuss forms of consumption. Excuse me. A lot of people come to me and they say, I don't want to smoke it. Smoking's not for me. They think that smoking is the only form to consume, and that is the farthest thing from the truth. So along with vaping or smoking, there's many different forms to consume. Vaping and smoking has a quick onset. So it's usually about 1 to 15 minutes. This relieves pain, nausea, anxiety, insomnia, and usually lasts about 1 to 4 hours. Again, depending on the type, the strain, and the percentage of the THC. Most patients decide they want to go with edibles, which is great. I always let people know if you're going to try an edible and you've never used edibles before, you definitely should cut it in fours. You don't want to consume an entire edible not knowing what this is going to do for you. So my suggestion is always to cut in fours. Take a piece, wait an hour, and then continue to go from there to get your desired effect. And edibles are made with the cannabis flower or concentrates. The THC is metabolized into the liver into a potent compound which amplifies the effect and it lasts longer. So if you consume an entire cookie, it's going to be a while before that entire cookie finally wears off and goes away. So you want to make sure cut in fours. Edibles have a delayed response onset of 1 to maybe 3 hours. So maybe even after that hour, you're still not feeling anything. And, wait a little bit. If you're not, take another piece. Again, you have to start off slow, go low, start slow, and then get up to your desired effect. Duration of edibles can last up to 12 hours, depending on the dose. Edibles are used for pain, sleep, anxiety, and edibles, like I said, can be tricky. So make sure you do cut them in fours and consume that way. Don't consume an entire edible, especially if you've never eaten an edible or done any kind of therapy or medicinal cannabis before. Like I said, I always tell every patient that comes in, start off low and slow. If something happens, you tend to eat a little too much of the edible, you consumed a little more than you think you should. Limonene is actually a modulator. I usually tell patients cracked pepper, or if you suck on a slice of lemon, it'll actually modulate how you're feeling so you don't feel so in a world you don't want to feel that you're in. So again, suck on a lemon if you eat too much of an edible, and you'll make sure that you have a little less of a potent effect. We also have tinctures. I do usually provide information about tinctures, especially to people who have to medicate a lot. A lot of medications, especially with smoking, tend to smell. So people who have to medicate a lot don't want to continue to have that smell on them. So tinctures are a great form. You can take it under your tongue, a couple of little drops. Again, start off a little bit. If you don't find your desired effect, a couple of more drops, fine. The onset usually can be about 15 minutes to an hour, and it lasts about 4 to 8 hours, depending on the strength. Great for appetite stimulation, muscle spasms. And again, it's really, really discreet. So nobody knows that you're medicating. Drops underneath the tongue, and you're good for the next couple of hours of medication relief. Another great form that I actually discovered a few years ago, topicals. Topical cannabis can be applied directly to the affected areas. It does not typically produce an intoxicating effect. And this is the question I get a lot. If I use this cream, will I get high? If I use this cream on my knees and take a drug test, will it come up positive? It will not. This is a topical, and it would take a lot of topical to get absorbed into your bloodstream. So again, topicals are great for muscle spasms, tendinitis, arthritis, skin conditions. I know a lot of people have used CBD topicals for eczema, psoriasis, things like that. So again, education is key. You can definitely look up all this information that I'm giving you and go from there. A lot of people tend to not like the taste of the topicals. You don't want to drink or eat anything 15 minutes before, 15 minutes after. But to get that relief you're looking for throughout the day without having to go outside and vape or smoke or eat an edible that might be a little bit too much of a dosage, the drops underneath the tongue are definitely a great option of medication. That being said, they now have transdermal patches as well, and this continuously will give you medication to the bloodstream over a time period. They can be THC and or CBD patches, but they can be used again the same way you would use other pharmaceutical prescribed patches. Great for back pain, lower back pain, muscle spasms in your shoulders. They do come in different sizes, and you can cut them to the desired size that you want to put on the affected area. So again, you just want to remember, start off low, go slow. Dosage depends on each individual. So your local dispensary can definitely give you the information that you're looking for on dosage and usage. Usually when you do go to the dispensaries, though, they do have a menu, so it will give you this information. A few dispensaries actually have the addition of having terpenes listed in their menu, so you know which terpenes are in your medication that you're purchasing, which is a great benefit. Thank you to all those dispensaries that do that. So you just want to make sure that you're checking out your dosage, you're doing a dosage that's going to be good for you, and then if you have to up it by 1 gram before you go a whole edible. So today, again, we just went over the information, the terpenes, the cannabinoids that is in the cannabis plant, as well as forms of how to consume. If you do have any questions about any of this, you can contact us at 866-846-2420. We'll definitely answer any questions that you have, give you information about what was talked about today on Green Chat, and book your appointment if you want to come get your card. Remember, we are in 13 states, so we are all over the United States. If you're looking to get some kind of relief and stop taking the pharmaceuticals that your doctor has prescribed, they're not working, you're looking for something to add, maybe a topical to help your backaches after work, again, come get your medical cannabis card here at Canacare Docs. We are, again, in 13 states, and we're here to help you get a better quality of life. So that's going to end my time here today on Green Chat. So I want to thank a few people. Again, thanks to Maggie and Erica, my fellow coworkers in those other states. Thank you for all the work that you do. Thank you to the entire team at Canacare Docs. We deal with patients every day, and thank you for helping those patients get that better quality care of their life. I'd also like to thank CB2 Insights and Katie for being my background dancer, as well as Eric B. Media for allowing me to come here today. I hope everybody has a great Tuesday, and maybe I will see you next time. Thanks, guys.